The SFA Nursing School isn't just a program to help grow future nurses. This program has unique challenges students must face, a state-of-the-art facility, and even simulated patients. Learn more right now on SFA Now. Hello, welcome to SFA Now. My name is Luke Hamilton, and today we will be showing what being a nursing student at SFA really takes. With me is Dr. Tamara Harris, the director of the Dewitt Nursing School here at SFA. How are you doing, Dr. Harris?
I'm doing great.
Great to have you here in the studio with us. So let's go ahead and get into it. A little bit about yourself. What kind of brought you into the field of nursing, and what makes you tick every day to come and help these nursing students here at SFA?
I don't know. I think I've always wanted to be a nurse. It was something I was really interested in high school. Science intrigued me. I've been a nurse for over 30 years. I've never felt that I wanted to be anything else. It's always been a good career choice for me. I love working with nursing students. They keep me on my toes.
So specifically with teachers and yourself being a part of the field in that way, what are some of the big challenges that they face? It's a very difficult degree plan to get into in the first place. What would you say some of these students face in clinicals that are so difficult?
I think the biggest thing is just learning how to manage their time, prioritize what needs to be done with a patient or a group of patients, trying to decide what's the most important thing to do next. And then just having the knowledge base needed to be able to safely take care of patients.
So with SFA being so productive in the way that they bring high technology into the nursing school, what are some of the equipment that these students get to work with on a daily basis, and how are they learning sort of how to get the edge in the future of technology in the field of nursing?
We have an incredible simulation lab out at the DeWitt School of Nursing. We have cutting edge mannequins that basically do anything a real patient does. We have all the support equipment that they're going to be seeing in the hospital, so they get to utilize that, use it on a regular basis, learn how to use the equipment, get comfortable with it, so that when they are in the real life setting at the hospital, they have a lot more confidence in what they're doing and are just a lot more sure of themselves.
So when you talk about these sim patients, these are pretty incredible to be able to watch. What are some of, go ahead and go through how they work with these sim patients, because there's a lot of different symptoms that they can emulate during their work with them. So what kind of are the symptoms that these patients can emulate on the fly basis, and how do these students work with them every day?
These are hooked up to a computer system, so we have a control room in which the faculty are sitting in there running the mannequins. They can change anything about the mannequin, any of their vital signs, the size of their pupils. They speak through the mannequins, so the faculty are actually talking as the patient to the nursing student that's in there. And so we can simulate any kind of medical condition and do practice a lot of different things that we either anticipate that they'll see at the hospital, or maybe even some of those critical events that they may not be able to experience at the hospital. We can't always schedule, when patients are having a heart attack or a stroke, but we can simulate those each and every day.
Right, and so specifically with the state of Texas, students coming in, being a part of the SFA nursing program, how difficult is it to get into the program, not just here, but what does it take to be an RN, which is the ultimate goal for a lot of these students here in the state of Texas specifically?
Well, nursing programs in general are very competitive to get in because there's a limited number of seats that each program has available. We have a 1 to 10 faculty ratio with students, and that is mandated by our Board of Nursing. So we can only have 10 students for every faculty member. That cuts the numbers down somewhat. But as far as what it takes to get into a program, we look at a GPA, and especially a science GPA, since that's kind of our foundation knowledge. There's also an entrance test that we look at that focuses on their math skills, verbal skills, science skills. And we take those two things to determine who our best candidates are each semester.
So everything sort of runs through the Dewitt School of Nursing here at SFA. So now that we've learned just a little bit about the nursing program and school faculty and facility here, let's go ahead and take a look at the students in action at the Dewitt School of Nursing. The Dewitt School of Nursing is a $13 million state-of-the-art academic facility that has been growing students into professional nurses since 2010. Students that get accepted into the program work through clinicals at the Nacogdoches Hospital, all while taking their normal classes as a college student. Having the experience of already helping patients at the Nacogdoches Hospital and helping in the community when students become registered nurses, they're equipped with the skills for many job opportunities.
Yes, I think SFA nursing program has prepared me. I believe that if I were to go out and try and work on the floor right now, I kind of knew what I would be doing.
Being a one-of-a-kind nursing school helps SFA stand out from other top nursing schools in Texas. Historically, having a high passing rate and high graduation rate, it's the nursing facilities, instructors, and students that make this program one of the top 20 schools for nursing.
I think what a good nurse looks like is somebody who's always willing to put their best foot forward. Somebody who's always willing to make sure that they provide the best care for their patient no matter what it is. You know, sometimes as a nurse, sometimes your patient may ask you to do something that you think is just the silliest thing. But I feel like being a good nurse is being able to do that. And not put second thought into it, because you know you're caring for your patient. It's what your patient wants, what your patient needs. And so I think that's what a good nurse looks like. Somebody who just provides their best care for their patient, no matter what it may be.
Some of the state-of-the-art equipment that the nursing school has available is the simulation labs, or sim labs. Each patient is in a hospital room that is monitored by the instructors. The instructors can change the patient's pulse, make their pupils dilate, and can make the patients vomit. They even can make them have a baby. The mom sim patients help students practice who want to be labor and delivery nurses, but also helps future nurses who want to specialize in working with babies. Other equipment that the nursing school provides is sim arms that helps students with putting in IVs, taking blood pressure, and helps nursing students look and feel for veins. The goal for the school is to produce leaders for the nursing community and to grow their students into professional nurses for the workforce. This has been a look at the Dewitt School of Nursing and how it's using its state-of-the-art academic facility to grow students into the future of the field of nursing. If you're just tuning in, we are here with Dr. Harris, the director of the SFA Nursing School. The Dewitt School of Nursing has so many great opportunities for these students to flourish when they come in, but what does it take to really get into this specific nursing program? What are some of the things you're looking for?
We look for students that have a great science foundation, of course, so they've been making the grades, working hard. We also look for just well-rounded individuals, people who can multitask, juggle multiple things, because that's what they're going to have to be doing when they're working as a nurse. And obviously the other thing is looking for students who are kind and compassionate in caring with people.
So specifically, you talk about some of the tangibles that these students need to have. What are some of the ways that high schools around here sort of creating those tangibles?
I think a lot of students who are interested in nursing usually are involved in the HOSA program at their high school. So they may be learning how to be nurse aides or pharmacy techs while they're still in high school and gaining those certifications so that they can get a little bit of real life experience before coming to college and really getting involved in the career path that they've chosen.
So I know, just speaking with some nursing majors, the RN role is something that a lot of nurses want to be a part of. What are some of the other ways that you can sort of get into this field and specialize in? What are some of the other interests for students specifically?
Okay. All basic nurses, who graduate with an RN take the same licensure exam, and they're all pretty much educated in the same way. So everybody gets a general education. But once you graduate, then you can choose whatever area of nursing you want to get into and gain a job. And then after that, you can gain certifications in that particular area. So we have a lot of students who get into critical care, the OR, the emergency room, the NICU is a real popular area, and they can gain certifications in those areas. And then of course you can go on and further your education and get your master's degree. And we're very lucky here at SFA because we do have a master's program that focuses on being a family nurse practitioner, and that's a recent addition that we've had.
Okay, so these young students, 18, 19 years old, 20, 21 years old, life changes, thoughts change, things like that. How can somebody go about, say, becoming somebody that has the interest in the nursing program? How do you see students transition and almost change their majors to the nursing program?
I see a lot of students who maybe have had a personal interaction with the healthcare industry, you know, in some form or fashion. A family member was ill, and they've really been, you know, watching the healthcare workers, and they've been influenced by the care that their family member has received or they themselves have received. And it really changes, it's a life-changing experience, and they truly see themselves in that role, and it's something that excites them and really, you know, lights the fire of getting into a nursing career.
So seemingly in every degree plan, there's the ups and downs. There's the exciting part about being a part of the nursing program, specifically here at SFA, but you look at the daily life of, say, a nursing student, it can be exhausting. Sort of talk about a little bit of what that daily routine looks like, especially when you're getting ready to get out into the real world.
Okay. Yeah, you'll talk to most nursing majors on campus, and they're probably not the ones having the most fun on campus always, although they do have a lot of fun together. You know, these students work long hours at the hospital. You know, sometimes they're working 12-hour shifts at the hospital, which is very exhausting. And then they also have to study a lot. So they are not usually the ones that are out partying every night. They have got their nose stuck in a book a great number of times.
So sort of how can you compare that lifestyle to the school lifestyle of getting the degree in the first place to transitioning that into real clinicals?
Well, I think a lot of it, you know, it prepares you to work hard, you know, when you get into the clinical setting. And a nurse's life is not the, you know, it's fun and games. We have a lot of great times. But when you're at your shift and you're working with your patients, it's serious. So it really teaches them how to focus and be that person that is responsible and accountable for taking care of another human life.
And so very quickly, just in all of your experience being a part of the nursing program here at SFA and even practicing it yourself, what's one thing that you want somebody to take away just shortly?
I think the biggest thing is it's a great career to get into. It is so flexible and can meet a lot of different personalities. And so I really encourage young people to consider nursing. Because you can do anything with it you choose. It's very broad.
Well, Dr. Harris, thank you so much for being here today and informing us on the nursing school facilities and how you can get accepted. So thank you for joining us today on SFA Now. I'm Luke Hamilton, and that is Dr. Tamara Harris. Thank you.